Yes, I know, recording. We got to have the backups of it. Okay, I'd like to welcome everybody back to Alabama Care. Today, we are going to be talking about the STEP program and transitioning from pediatric to adult healthcare. We have a number of guests on with us today, and at this point, I'd like to hand it over and ask our guests to introduce themselves. Mrs. Mary Roth, if you would introduce yourself.
My name is Mary Roth, and I'm the Director of Adult Services here at United Ability. And I come to this team with a long history of passion for transition, education, and transition services for folks. It's so important. Throughout my career as a special educator, I ran programs with work instruction and community-based programming. And so this is a very important topic, and I hope we have lots of folks turn out for this on Saturday.
Yes, and today we're going to be hyping up the conference this weekend at United Ability starting at 8 o'clock. So we hope you guys are getting excited. Mrs. Ginny Rediker, if you would introduce yourself.
Hey, I'm Ginny. I am one of the CRS transition specialists with the Homewood office. And I have had such a pleasure working with Mary in different aspects of transition over the years, and was really lucky we got to connect with Dr. Somerville and the STEP program. And so we've really been excited to make these connections between interagency folks so that we can really focus on successful transition for our young people.
I appreciate you being here as well. Ginny, we've known each other for a number of years and have mutual acquaintances there. Dr. Somerville, if you would introduce yourself.
Hey there, thanks so much for having us today. I'm Dr. Somerville. I am a Birmingham native, did my medical training here at UAB School of Medicine, and then did my residency in internal medicine and pediatrics, and have been really lucky to care for patients and families across the lifespan, really 0 to as old as 107. And in my time in medicine, really one of the big gaps that I witnessed in my everyday practice is what happens to our patients when they make that big leap into adulthood, and really saw that go wrong for a lot of patients, saw a lot of fear during that period of life. And that really motivated me to want to change the system here at UAB and Children's, and really build a bridge for our patients and families when they have to make that scary leap. And so that led to myself and my partner, Betsy Hobson, who's not here with us today, really sitting down with a lot of stakeholders and putting together what is now the STEP program, and what serves as really that bridge for patients to find resources as they go through that transition.
And speaking with other community members, families, individuals, I've heard that transition is pretty tough, like getting out of the education system at 21. What does life look after that? Employment, long-term living. But I never really breached the aspect of healthcare in that transition. And now to others, let's start off. What exactly is the STEP program?
Sure. So STEP program, as I said, this really evolved out of a partnership between Children's and UAB, and really, again, that gap that many patients and families have experienced. And so STEP stands for Staging Transition for Every Patient, and really started as just a half-day-a-week clinic where any patient and family over 18 with any disease of childhood can come and see us in that clinic if they have basically any questions about transition, if they're worried about what is that process going to look like, who are my adult providers going to be, can I find adult providers that will care for me the way my pediatricians and my pediatric specialists took care of me. And then the other amazing piece of STEP program is that really it's multidisciplinary. So we have incredible social workers like Ginny and others from CRS who come and help those families really talk about what are all the social issues that come up for families during that age, and what resources can we plug them into related to, like you mentioned, employment, school, other day programs, or other insurance resources, lots of issues that come up at that time. We also have a physical therapist in clinic with us. And then for patients with specific diseases, we actually bring a lot of subspecialists to the clinic with us. So we have a rehab physician who comes with us, Dr. Powell at UAB. We have an epilepsy specialist, Dr. Vo at UAB, who comes and see patients with us. And that's been really meaningful in really reducing barriers to patients who have to go to multiple clinic visits on different days and who drive long distances to be seen in the healthcare system. We're really trying to use a multidisciplinary clinic model, and even telemedicine to our advantage to make these medical visits easier on the families. So that's the basics. I could probably talk a whole hour just about all the incredible pieces of STEP Clinic, but really the takeaway is we're looking to make every patient's individual transition the best possible for that family and to reduce barriers along the way.
Now, you guys are taking a very holistic approach here by getting all aspects involved through CRS, through the healthcare needs there. And why, you kind of touched on it a little bit, there's a difference in insurance, but why does this transition happen for anybody that may be younger or have a son or a daughter that is younger and they're not sure what is coming up? Why does this transition happen? What is different during this point?
Yeah, I think that's such a great question. I mean, so much in the past related to transition has really been more of a transfer of care at a specific age, whereas transition, like you mentioned, we really want to look more holistically at how do we prepare for transition from as early as the age of 14 for every family? How do we make that standardized across the lifespan so that we're preparing our families so that when they turn, 18 to 21, it's not all of a sudden the door is closing, you need to go find your whole new medical home. How can we have like more of an organized approach that works best for each family? And so that's what we've really tried to do with the STEP Clinic, is take every patient as an individual with them and their family and see how can we make this whole process seamless and organized and not feel like you're about to really, fall off a ledge or lose your doctors or your healthcare access.
That can be
Carlie,
quite.
I have a quote that I'd love to share from a parent who came to the STEP Clinic, following up with that kind of a thing. It is just like a cliff that they fall off of. And from the years of transition planning that Ginny and I helped do, the medical piece was always missing. And that is probably the most important thing, their health and their livelihood. But this mom wrote me, it was maybe right at a year ago. She said, with the support of the STEP Clinic, I think more primary care providers will feel comfortable caring for adults like our daughter. She had an appointment there last week and it was so wonderful. I started crying in the middle of the appointment. So it's being so well received by the families that you guys are serving, for sure.
And if I meet individuals or families that feel like they kind of fall off a cliff after 21, the first question is, well, are you in kind of the system? Are you in the ADRS system? Are you currently receiving services? And Ginny, as you mentioned, you're with CRS, so you're with these individuals, and this has been a process that you've always done, but now we get to introduce the other aspect of healthcare through this process.
And Alex, what we hadn't had before was a really obvious and accessible medical transition. So a lot of what CRS does is medical clinic. So yeah, we were able to hand off to our vocational rehab partners, but that's not appropriate for every case that we have. And in fact, a large majority of our cases weren't necessarily going to go to vocational rehab. They needed that medical care in the next phase of their life, and we didn't really have a clear landing zone. And so what STEP was able to offer us was a true handoff, and we're able to be there in the process. So you've maybe known me or my system since your little guy was 3 or something, but now we're with you as you're moving into an adult world. And so you're able to see these familiar faces again, and it makes it a lot more clear, warm, and it gives families more support and reason to keep buying into the system, because what we really don't want to see is appointments drop off. Mm-hmm. Suddenly we're not seeing a neurologist anymore. We're not seeing primary care the way we should. And our healthcare outcomes are going to be so much worse. And so we really want that warm place for families to feel supported and cared for.
Yeah, that preventativeness, don't go to the doctor when it hurts. You should be going to the doctor every year. Making sure that everything's going well. And it can be very scary going to a new doctor, a new organization, new building, but to have that friendly face that you're familiar with, that you've known, that you've worked with, really helps that transition. Now, if you could give us a little bit of the history, when was the STEP program first started? And how's it going so far? Enrollment, those kinds of things.
Yeah, so now I have to go back in my historical years here, but things are going so amazing, and so much of that is because of the collaboration that we've had. I mean, I feel like every week, every month, we're meeting new people with like-minded passion and who really want to make a difference in our families and patients' lives. That's how I feel so deeply about meeting United Ability and being able to partner about this upcoming conference. But it's been really just like serendipitous event after meeting after event after meeting with so many people who just continue to bring more resources. Thinking back to the start, we started seeing patients in the fall of 2019. So we're a little bit close to 2 years. Fall of 2020. Sorry. Am I correct, Ginny? You're going to have to help me.
Yes,
Like
yes, it was fall of
pandemic.
2020.
Fall of 2020. Sorry.
We're almost 2 years, right?
Yes, we're almost at the 2-year mark. I know that, and the goal was to start in 2019, but lots of COVID and other issues got in the way of that. So September 1st will actually be our 2-year mark, and things are going really well. So well, honestly, that we are over 6 months booked out with follow-ups and new patients. We're looking to expand into Wednesday afternoons to a new clinic half day in this coming September is the goal, because we, as word of mouth travels and our patients, spread the word of the work that we're doing, we have interest really from all over the state. And that's one thing that we didn't really anticipate that we probably should have in the beginning, is that so many patients and families from all over the state have been driving to Children's for most of their lives for care. And we kind of underestimated the fact that so many of these same families would say, no, we want to drive to UAB to be a part of the transition program and get resources there. And so we've just seen the demand continue to grow. And we're doing incredible work. We're meeting so many incredible families. We had a patient caregiver advisory board meeting last night, and I can't think of anything more inspiring than to spend your time with parents who have really, been at the forefront of advocating for all of our special needs families and for their children over the course of their lifetime. And so I think all of that is just coming together and motivating us to grow and continue to really advocate for more resources in the health system, because I think that, we're slowly expanding, but I think there's so much room to continue expanding to be more accessible. And I think our dream one day would be really to have an accessible everyday clinic for these patients and their families.
I feel like sometimes families may feel like they're kind of unheard when they speak with their professionals, doctors, those types of things. So when they have the opportunity to give feedback, like you were saying, that feedback that families were giving, and interact with doctors that are passionate and know about the disability community, they're going to come, they'll come from Mobile, they'll come from Huntsville. And if they can get all those services one day, one location, I know that you guys are going to continue to grow. Now, I did see something, some of the funding, does that come from the Alabama Developmental Disabilities Council?
So recently we did receive a grant through that organization that is going to give us some resources actually to connect back to rural primary care practices all over the state. So that is one of our missions, is really increasing education for other providers. So primary care doctors, family medicine providers, how can we make sure that we're growing a population of future doctors who know more about how to care for these patients, who are comfortable out in rural communities all over Alabama caring for these patients. Because again, that's one of the things that most of our transitioning families tell us is many of them have tried to establish primary care in the adult world or seen specialists in the adult world and already had negative experiences just because they felt like the provider wasn't comfortable. And so that's really some of the other work that we're doing, is how can we, really train the next generation of physicians to be comfortable and to have that knowledge to care for these patients. And then also, how can we connect all this incredible resource we have at UAB and in Birmingham to some of our rural communities, so that maybe one day all of our patients don't have to make the 4-hour drive across the state just to see us. And so that, so right now we're kind of building what that program is going to look like, and start with a pilot group of 8 to 10 rural practices.
Yeah, that's awesome. So I didn't think of that as training the up and coming doctors. So not everybody has to come to Birmingham, but the rural doctors are very well trained in how to, serve these individuals. Now, for anybody that's like, okay, this is great, but what is it going to mean for me? What are some success stories? Mary, you've already mentioned one, but are there other success stories that kind of pop up? I'm putting y'all on the spot now.
I know I was going to give, I was thinking Ginny might have a good answer for
I'm
this.
I'm like, how do I do things without
brought us so many amazing families. I mean, again, like to the credit of CRS while she thinks, I mean, like, I don't know if we would have been able to have such an incredible start we did without the partnership with CRS, because for so many families, hearing about this new opportunity and no word of mouth yet about what really happens there, our CRS social workers were crucial, because these families trust them. They've known them. They've been with them on their journeys. They've been in their homes. They've been such an important part of their lives that, I mean, I think back to some of the first patients who walked in. Well, if Ginny says she likes you and trusts you, then I guess I'm gonna trust you too, and I'm gonna give you this leap of faith to let you to see how this whole process goes. So I mean, I give so much credit in our success to CRS being such an important part of our weekly work.
Yeah. And I feel like I need to make sure it's known, I'm just one of the many CRS workers who actually support STEP. We had an amazing amount of buy-in from our office. And so we have 3 transition specialists and 2 TBI specialists who come and give of their their time so that they can watch their patients transition over in STEP clinic. And so we've been thrilled to be part of that. And I think it was one of the first families. I hadn't seen them in about 1.5 years. They had aged out. And I got to see a mom that I had worked with for years. And it was the first time I'd seen her in a while. And there we were in the STEP clinic office. And I got the biggest hug. And the young person I've been working with all these years looked great. And they got to move over to Dr. Somerville. And I knew that they were going to be cared for in the way that they deserved. And I think that was one of the moms who left feeling incredibly calm and happy and finally settled in her healthcare. And that's really all we want. We want to know that what you've gotten in your pediatric world won't leave you, that you'll be able to be well loved and cared for, and be able to trust that your providers are looking out for your complex need young adult. And so I think we've got many stories like that, but there was one family that did stick out. It's hard to explain individual stories without worrying about running on the wrong side of HIPAA. So.
Yeah, no, I definitely understand.
Well, and I can add to that a bit, in the big picture with us at United Ability, quite a success story is that Dr. Powell, one of the physicians at the STEP clinic, has been able to set up a monthly clinic at our building here at Link Point in our adult services building. And I believe as of today, she served an estimated 50 individuals just since September. So that's a huge, huge, huge plus. And we, just like Dr. Somerville said, we're so excited to partner with the STEP clinic as well. So.
I give a shout out to Dr. Powell. I have a family member, and Dr. Powell sees my family member. So she's great. She's always open for questions, and I really appreciate the service that she does. And Ginny, you kind of mentioned some of the success stories of just that feeling of calm and being, and I feel like it can be so stressful with the uncertainty where we're not sure what's going to happen here. But once you get into the STEP clinic and realize that you're going to be well taken care of, it can relieve loads of tension, and you just feel like you're home and with people that really care. I'm going to acknowledge the chat really quick. Sarah Williams says, Ginny, hi. Charlotte Russ says, Ginny is such a friendly face. You all are, by the way. Kim Spangler says, is there a one-pager you can share with us to help promote the work you do through social media special interest groups? So Kim, I'll go ahead and get that, and I'll post that in the chat. We do have the agenda for this coming weekend that we will also post. And Sarah Williams says, love Dr. Powell. So now that we have this STEP clinic, it's been up and running for 2 years. We're seeing a number of patients. We're continually growing. What is kind of the end goal, or what do we hope happens with and through the STEP program?
Yeah, no, I mean, I think, again, in an ideal world, we're going to continue to grow. We're going to continue to build collaboration and partnership. I mean, we're already working on several new partnerships for the coming year. One specifically that I feel like I can comment on because things are going so well, but we're looking to bring in an endocrine provider soon, to, hopefully in the fall, to clinic with us. And we've just had so much buy-in from different specialists. I mean, a lot of our adult specialists at UAB are really excited to work with us. And I'll joke, I mean, even one of our renal colleagues who was working with us, one of the first things he said is like, can you just help me figure out how to talk to families? I'm not, tell me how to talk to moms. I never had training in how to talk to parents. I'm used to just talking to the patient. And in a lot of our transitioning young adults, that's a crucial piece of the interaction, is how to really support the family, not just the patient as they go through this process. So so many adult providers at UAB have just been incredible and want to partner and want to share resources and learn from us. We've had a lot of specialties want to send their fellows and trainees to work with us and see what this looks like. And so lots of really interesting things happening as far as growing collaboration, and then a lot of educational work. Like I mentioned, we're actually working with the National Spina Bifida Association, looking to create more accessible modules for, again, adult providers to feel comfortable caring for patients with spina bifida. And if that work goes successfully, I see us being able to use that in other patient populations as well. So really growing that educational impact, like I mentioned, so that we know that our next generation of doctors are comfortable to care for all patients with disabilities and special needs and really any disease of childhood. And then the other piece I mentioned, just really, I see, a bright future where we're able to grow this clinic, and hopefully one day, again, being able to have this clinic every day of the week as a medical home for any patient who this is a good fit for and who really needs this higher level of multidisciplinary care to be successful. So that's really my down the road dream, but so far every day seems to be more and more promising. So
I love that doctor spoke up and said, hey, I'm looking for some communication training on how to speak with families. Yeah. And I think that's a huge part of it. It's not that they don't want to, it's just they're not familiar. And so to have that training, that communication training, be a part of that process for the doctors, for the specialists, I think is huge, because when you walk in somewhere and someone's able to communicate with you, it relieves a lot of stress, like we said before. So just having that familiarity there. Speaking of talking with families, around that time, around the age of 19, we hear a lot of talk about supported decision-making, other forms of guardianship. How do we navigate that at the STEP clinic when maybe we need to talk with more than one person?
Yeah, that's a great point and such an important piece. So like I said, so many of our patients are coming in with as a whole family unit. I mean, we'll have up to 5 or 6 family members at some of our initial visits. And that's really important to us because we really want to get to know the patient, their family, what are all the factors at play, and having that successful transition. And so our first visits is really a lot of just like getting to know families and the patient, and what are their dreams and goals, and what makes them happy, and where can we help them. And so that's really the beginning process. And then we start to set the stage that for a lot of our patients, there will be times where we ask parents to leave and give our young adults that chance to have that one-on-one time with their physician, whether they have questions or not. And so that's very routine for us to have that kind of as the expectation for families. And that can be hard for the patient and for the parents as well. Some of our parents have never really left their child's side at a doctor's visit. And so there's just all kinds of interesting pieces to it. Yeah, lots of interesting dynamics. And certainly we just want to set the expectations and let families know that that's an important part of what we do. And then that we make sure to bring everybody back together and communicate a really clear plan with the whole family before they leave. So some of those initial visits can be really long. Some families will spend really up to 3 or 4 hours with us on that first day, getting to meet everybody and really, again, have that time to tell that story. And that's really, again, something that's so important to us. In order to give good holistic care, we really need that time to get a basis of what these families have endured for 20 years.
Yeah, it's really a lot more than just looking at the blood work. When you think about going to the doctor, taking blood, all right, my doctor will call me back in a week with my blood work. But there's so much more when helping these individuals and helping these families.
We're also assessing, we are assessing transition readiness at these initial visits, and then periodically throughout these visits, kind of trying to help the families and the young person gauge where they're at. And so we're not just, guessing. We're actually kind of having them look go through an assessment, kind of really think about each step to their medical care
Hmm.
and figure out when they're really ready to take on more of the ownership of their care. And then we're creating transition plans for each of these families. And so some of those transition plans are going to involve things like, okay, maybe we're always going to have mom and dad involved in our decision making. So let's really figure out how that's going to happen. Is it going to happen through guardianship? Is it going to happen through a supported decision making plan? Is it going to happen with a power of attorney? And so that's our job as social workers, is to really put onto paper an active plan with a family, so that these areas that we know have to be taken care of are kind of put at the forefront, even during the medical component of the visit. And so I think that's what's so wonderful about our STEP clinic physicians, is that they're asking these questions too. Dr. Somerville and Dr. Eckenrode, they're thinking about, hey, what's your broader plan as a family? How are we going to do this medical decision making? And so it's not just your social worker, it's actually the buy-in from your primary care doctor, who's completely involved in that aspect as well, because they understand the importance of it.
And sometimes when you're in the day-to-day, in the thick of things, it's kind of hard to see to tomorrow or what the next step is. So having, family, friends, professionals around you that say, hey, this is kind of the path. Others have done it. They've been very successful. We need to look a little bit ahead so that we know how to do this today. That can be a huge benefit in everybody's life. Like, hey, I know you're in the thick of things. You're working in the business. Kind of need to take a step back and work on the business a little bit and kind of see where that's going. And then you mentioned that, individuals taking over their healthcare, learning about that, what it's like keeping records, those types of things that helps build confidence. It's a confidence builder when you go into your doctor's office and you're able to speak on your own, and talk about those things and what's going on. And I love that the individuals get one-on-one time with the doctor. So my grandmother is 90 years old. I take her to the doctor, but there is a part in every doctor's visit when I look her in the eyes and I go, I'm heading out. You guys chat it out. I'll come back in 5-10 minutes. If there's anything you want to say to the doctor, you don't want me knowing, got it. I probably don't want to know either. So, now we will give Dr. Somerville a little bit of a break here, and I want to transition to this weekend and hyping it up. So let's talk about the Expo going on at United Ability. What time does it start?
Yeah, so I think you were going to share the agenda with everyone.
Let me, while we do that, let me share screen.
So the registration has been ongoing. We're going to
Clifton,
get
if you
started.
could allow me to share screen real quick.
Okay,
I'm sorry,
okay.
Mrs. Roth.
No, that's okay.
Go ahead, and then I'll pull it up when I get access.
All right, that sounds good. So we're going to start the day around 8 with registration. It was a pre-register event, but we are having recordings done. Thank goodness. It'll be able to be shared afterwards if you were not able to get registered. So you can see from this, we have a packed day. We're located at 101 Oslo Circle. The building looks like a beautiful rock lodge, and we're straight across from a fire department. So those are some kind of landmarks to help you find us. But we're starting the day with Dr. Powell, Dr. Eckenrode, and kind of explaining the STEP clinic, the goings on there. And then we're going to move on into some segments about physical therapy, occupational therapy, et cetera, and how that's connected. And then Ginny's going to support a program, a session from vocational rehab with different assessments that they're able to do. And then the breakout sessions are going to be really interesting. We've got 2 different segments, one of community resources and another one that's geared and work toward career and college goals during that time. We'll have some representatives from United Ability and both of those sharing. And then in the afternoon, it kind of heads into the advocacy that we were just talking about, the importance of that. We have some experts that are the actual folks that receive some of these services here to speak with us. We're fortunate to have 3 different attorneys on the vendor panel, but then one of them is going to be on this advocacy and guardianship panel with sharing lots of important information. And then one of the probably most important areas as well is the mental health piece of all of this. We're really excited to end the day with some experts in that area. So it's going to be a very packed day, and Dr. Somerville and Ginny, I'm sure, can agree that we've learned a lot from this planning process, and we're already looking forward to next year. And it's a topic that could go on for weeks in all the different areas, but this particular conference is geared toward the medical aspect of it. And so we're just so excited to help families make those connections that are so important.
You guys have quite the lineup there. I feel like you're, like you said, a week's worth of resources into one Saturday. And I'm sure it's going to be packed, but what should somebody expect coming to the expo? Should there be a specific goal? I'm going to this expo to come out of this, having learned this.
I would like to encourage all families to come out of this not being overwhelmed, because they're going to be flooded with information. Come in here with an open mind, with an, and just be a sponge, listen and learn. Just know that the help that's available doesn't end on Saturday. That's just the beginning for them. The STEP Clinic has created an amazing resource in the community for families, and agencies like United Ability and many other agencies that are going to be there as vendors, CRS, et cetera, are there to hold these folks' hands all the way through the process. It's just a matter of encouraging them to reach out and stay calm and not get overwhelmed with the information. So
yeah. And is there a target age group? So would you say families who have a son or daughter that's 14 to 25 definitely need to be there? I think that's kind of the hot spot there.
Yeah, I think so. I think we actually went on up to 30, but yeah, that's definitely the hot spot when that cliff starts going down with resources, and you just got to hang on for dear life. I know in the past I would tell families that, when their children are born, they're superstar advocates for them, and they're just looking for everything. And then that they kind of get tired, and that wanes a little bit. But at the time, age 18, that's the time, and 14 even, that's the time they've got to kick in again and just start all over again, educating themselves about what's out there, how to help their son or daughter to be happy and successful. So.
Now, you mentioned a piece about registration. Can somebody show up 8 o'clock on Saturday, just walk in, or do they have to pre-register for the event?
Well, that's kind of a loaded question, Dr. Somerville. She's running the registration table. So we did encourage people to register. We have a limited amount of space here. If someone is sitting at home just on the edge of their chair about to fall out in tears at not registering, please don't hesitate to come on. But we're not going to turn anyone away that morning if we have to have standing room only here. But we, again, like I said, we are having recordings. We're going to have those available, and we're going to do this again next year. So
we'll be there, so you guys will get to see the video.
Yeah, so thanks to you.
I agree. We're very more the merrier, and find it very difficult to say no. So anybody who's really passionate and wants to be a part of it, certainly we're excited to share.
Yeah.
We'll put the registration in the chat as well. So hopefully we book you guys full. I am going to acknowledge chat really quick, and then we'll kind of round it out. So Kim Spangler says, plain language translators are a must within the medical field. I think it should be part of doctors training, but also a specialist position, because some people are just gifted that way. I see Think College programs hiring for this. Kim Spangler also says, when a person signs a HIPAA release to include a member of their SDM team, this can be another way to introduce a plain language translator. So involving, family or friends from the SDM team is a great idea there. And Charlotte Russ says, thank you, Mary, for the wonderful work you do at United Ability, and especially for all your remarkable love of people with abilities. The transition to adulthood event is a great collaboration. So it looks like the audience is pretty stoked for it as well. So yeah, we will be there broadcasting from 8 o'clock in the morning until 4:30, or when the conference is done. And if you can make it to Birmingham to United Ability, and you have questions about the transition, any medical, this is the place to be. You're going to have so many professionals, specialists, experts within one building. If you have questions, this is where you're going to get your answers this weekend. Now, as we kind of round it out here, is there anything that we haven't talked about that you would recommend to an individual or a family member, specifically about healthcare, that would benefit them? Nobody jump at it.
Don't hesitate to ask questions. There's no stupid question. There's everything, you're the expert with your own child. I would always encourage families to know that. Share the information that you get with your friends, help educate the general public as much as possible about our folks. And so that's just off the top of my head, some things.
I feel like a lot of people don't talk. They don't have the peer support network. So you just like that doctor that said, I'm not sure how to communicate like this. You got to speak up.
Yeah. And I think, when I think it can be very scary meeting a new team of doctors or going to a new place, but I would encourage people to, like Mary said, have an open mind and be prepared to tell your story and, even share your concerns off the bat. I think, most doctors like really do care and want to be able to give good care to the patients that they care for. And some people really just don't know or don't have experience or have never cared for a patient with, the same medical issue that your loved one or child may have. And so, as hard as that can be at times, just be open-minded, bring information, and then of course can advocate for your loved one. You know best. I say that all the time. If moms or dads are worried about something, then I'm much more worried about something because you're the one who lives with your family and has been on this journey. You know when something's not right. So don't be scared to stand up and say that even to the physician or team that you're talking to.
Yeah. Even if somebody's in a white coat, they're there to help you, but they need to know how to help you. Well, guys, I really appreciate everybody being on with us today. And I'm looking forward to Saturday. David Barry says, great job. It's going to be a great event for our community. And I concur. So at this point, we'll go ahead and sign off and we'll all wave at our cameras and say, see you guys on Saturday.
Bye, everyone. Thank you all